because of this problem they're called e-cigarette and vape. Are there any questions from the floor?
Ingat tu dia je takkan soal.
Tak soalan.
Ada kita balik.
Yes, ada.
Let's say, like, for us not to repeat that 50 years mistake, beside the current policy that we have, what would be the other recommendation or suggestions that you see would us reduce the risk for vaping?
Okay, I think in terms of Malaysia, first we have I think one of the most important, I would say, the success of our country is when we have our own law. In October 2024, we have 852 about smoking control, tobacco control. So those are, we are talking about legal aspect of it, So, and then I believe the commitment from the ministry also very strong with regard to the control of tobacco and tobacco product. Our challenge is always about politics. The commitment of the politicians, the leaders of our country to do this. And this is very clear. If you see the progress, that's why I mentioned about global, it average, mainly in developed countries. But if you look into the trend, the prevalence-wise, in 1960s, the prevalence in US and those countries around 47% smokers. But in Asia country, those 46% was in 2000. You can see that we are very late to recognize the danger. 50 years is for the West. For us, it may be what, 70 years? Delay. So I'm talking about country as a whole. You were asking, is there any other way? Of course, the other way that I can think of now is, again, I believe in education, awareness. As epidemiologists, I believe we have 3 levels of primary, secondary, tertiary prevention, and also, most important of all is primordial prevention, which is, we are hoping that we can create nicotine-naive generation. That's why GEG is the most important of all. GEG. We missed the boat. We almost got it approved in the first reading and suddenly changed the government and changed everything. Suddenly unconstitutional, but the UK recently have their, I think the other country is Netherlands. Is it Netherlands? GEG? Country, I can't remember. UK another one. New Zealand again, U-turn. Again, it depends on the leaders. But when I say protect the young nicotine-naive generation, is GEG. So if we can together believe in that and keep on pushing and lobby for GEG, so I believe it would be a lot better for our country.
Thank you very much for the questions and also the explanation. Any more questions?
Mana boleh?
Now, you were talking about normalization, right? Denormalization. We managed to denormalize. Almost, yeah. But again, you know, most people will not like when you see people smoking, and as you said, it's okay to vape, but not okay. But the other factor with vaping, even parents think that, you know, it's okay for children to be around, it is not dangerous. So how do you see that we can denormalize this as well? Because at the moment, it is not so much of a problem to the layman and the general public.
Yeah, I believe the answer is still education and the parents' awareness. And again, if you read the literatures, they are talking about the developed countries versus developing countries in terms of policy, and we can see the lag there. If you're also looking into certain countries that is very poor, like Africa, the prevalence is also very small, because why they can't afford cigarette. So in our country, you're talking about denormalize our tolerance for parents smoke in front of the children. So the answer is the parents themselves should recognize that those are those are dangerous. So how to do that again, I would say, is education. And this is where the community must come in. Who smoke normally? The male or female? Male. Male. So where normally, now vaping now but then still more male. But the problem with male ni, dia tak macam perempuan. Perempuan, they are quite strong when they are, I'm talking, let's say, we're talking about rural, kampung. The community among female is quite strong. They motivate each other. But not among the men, somehow. They in fact encourage others to smoke rather than the other way around. So this is where I see the role of community. That's why I asked about whether we have NGOs here. So the leader, the community leader must be approached and tell them, so at least they can start, they can attempt, they can try to talk to other men in the community. So we have to identify the critical point, macam hazard lah, hazard analysis, critical point control. So you must know which pressure point, macam puncher lah, you want to touch so that it can give the best effect. So if we are talking about denormalize, that's why I start to strategize in the sense that which community. I don't think in modern educated society the parents would allow that. Even if they smoke, they will be smoking away from the children. They don't want the children to even to see that they are smoking. In educated, but the non-educated, you can see that they are smoking inside the car when the kids are also inside the car. Ada yang rasa salah tak tangan kat luar, tapi mungkin masuk juga. So those kind of questions. So again, I see is that how to approach community-based, the peers, attack the peers. If more and more people talking about this, it will happen lah. But it is not easy, when it's not easy. And another thing I believe, social media, very lacking of content that asking people to smoke and showing the danger of parents smoking in front of the, not many, try to look at your TikTok, can you see one? Even difficult, not even one you are able to see. The one that passed through you, none of it about this. Of course people don't like it, but nobody even make it more content about this. So if we have now, all of us here, start to produce those content in your local language, in your community, I believe slowly we can create that so-called sentiment that smoking in front of your children is no. That's my suggestion.
I just want to ask two questions about.
Saya lagi ke?
Mana-mana pun.
I just want to ask two questions. One question is, in the long term, you said that for denormalize, what is the long term? But what is the short term of your prevention of smoking? And then the
Short term is raise the price. Yes, you can see just now when I made my presentation, if you increase the price, why is that in a country like Africa, the prevalence is very low? A single digit prevalence of smoking. Why? People can't afford cigarette. They cannot afford. There's no illicit cigarette. Nobody want to sell them because there's no purchasing power. They can't afford. If they have money, they want to buy food. They don't have. They can't afford cigarette. That's why the prevalence is very low in basically in African countries. So if you ask me, you want immediate effect? Raise the tax. 75% said WHO.
Thanks, Prof. One question is, we are battling about the industry. Is it any feedback from the industry because you are cutting their money? So
feedback? Memanglah dia tak suka lah. That's why I'm saying the other. Okay, if they don't like, okay, of course they will first and foremost will try to stop. I think my voice is quite okay. They will first and foremost will try their best not to have this tax rates in the first place. So they try their best to approach anyone, even pejabat agama, Jabatan Agama Islam. You know about that story. And they visited because, you see, they try to lobby. So it is based on our leaders to do that. And I will not going to give up on our leaders, but what we can do is to keep on pressuring our government. They have their own personal interest, why they protect certain. Nak cakap kan, macam mana saya kan, of course there are talks here and there, but we can't talk directly. The evidence, who involved, who are involved. So there are talks about this, even at higher official meeting also, kan Dr. Noyati, we were there. There are talks about this as well, who are the one that, but we can't mention it here. But those are the things we cannot touch. But what are those things we can do other than keep on talking about this? There's nothing else we can do. So if you have in your circle influential leaders, approach them and tell them how important this measure is, and how important and how dangerous if we are not going to continue with that. Dr. Noyati mentioned about 70,000, 150,000 cost for lung cancer. I'm not sure their survival rate. Is it 2 years, 5 years?
Depends, kalau stage 4, maximum 2 years.
You spend 150 per year, eh?
About 180 per year, no, more than that. If they are on osmetic, okay, it's 18,000 times 12, that will be 180, at least a good 200 plus. Of course, okay, prognosis will be better, 3 years, but can be like 3 years.
Imagine one patient that we try to save that can last for 2 years, 3 years, 250 per year, around that example. And they are not paying. They are not paying. We are the one who paid for their treatment. So now, Budi dah tinggal 200 liter. My ministry budget, kita punya budget dah kena cut 2.3 billion. For my university, meeting baru ni dia kata, I will have, our ministry suggest RUM to cut around 107 million budget this year. If we cut 100 million, gaji kena potong. Hospital pula kena cut 37 million, our UIA hospital. You see, duit tak cukup ni. The patient yang smoke, how many among them, Dr. Noyati, actually second-hand smoker? Very little, you see. Most of them self-inflicted. And now we are paying for them. We, all of you, are paying for these patients. And they are the one who, mostly you can see from the case, 60 years, 50 years, 60 pack cigarette smoking. So those are, so that's why how important that we must be very aggressive about this.
I think we need to do the sumut kuotela for.
Alright.
Food for dinner should be inside here.
Yeah.
So that you can go out of the community. Right. So it's very, very important to understand and to keep on advocating so that all the others outside, because most of the time if we are attending conference, especially on tobacco control, it's among those who are already into it. But the message doesn't go out to the larger community, right? Those who actually need those information. So it is up to us, like what the Prof just now suggested, that if each and every one of us can put up more content in their own social media, then the reach can be wider.
It is okay if people do not share your content. Keep on posting. Because you are talking something nonsense, people share, right?
We do a bit of community outreach. So we go to universities. So we've been doing it for the past 2 years. When we do it in the universities, it's such a norm to take this that it's almost like a joke among them. And like it's very, even when we're talking, we're just giving, counseling or nudging them.
That is what Dr. T mentioned just now. We normalize vaping. That's why recently one of the influencer was fined by KKM because even in his podcast, he was using vape. Gantung, for example,
It's almost like
or
a
display.
proud. It's almost like a proud thing. They
Yeah,
will
yeah.
all the different keychains and all that big devices that they
And
have.
even female, isn't it? Sometimes when we walk around nowadays, we can see female just gantung vape. Walaupun dia tak nampak dia, but then you can see there's vape. Belilah vape yang gambar lain sikit ke at least kan.
It's just education. I don't know how much more, like we're doing it, but I don't think.
For me, let's see how success we are for cigarette smoking. So, after 2000, we can see the progress. Very good. And because one started with the FCTC framework, and then everybody is doing it, we can see the progress. So now, that's why I'm saying, now come e-cigarette. We already almost successfully control cigarette smoking, and then they introduced e-cigarette in 2012. I remember, I was in flight with Haniki. I know Haniki is the one that really into smoking. That time, my friend, the one tried to, in 2012, my friend wanted to introduce, he was a heavy smoker, he wanted to introduce e-cigarette. He said he tried to approach everybody, tried to sell everybody. He got a contact in China during that time. Vaping is not really well known then. So when I see this poster, I said, don't quit, but tukar, switch. And then I wonder, is this okay or not? Because we were wondering, is it okay or not okay? This is not cigarette, this is very new. So I talked to Haniki in the flight. Haniki pun masa tu tak aware about, because this is very, just something like business kind of thing, so not really go into market yet. So in principle, Haniki said sebab ada hand movement, therefore not good. But other than that, we cannot comment. We do not know the health profile at all, safety profile of vape. 2012. Only 2015, I applied a grant 2015, rejected. 2015, KKM approached Haniki and me to produce one study. That's where NECS come about in 2016. And then the rate is around 3.8%, and now the rate is 5.something% e-cigarette. Then was 3-something%. So you see, 2012, they were faster than all of us to even to recognize the danger. So now we know that at the beginning, when Dato' Roman was still Deputy DG, he wanted to ban altogether, just like Singapore. But again, we are facing some resistance higher up, so it did not happen lah. And yang paling teruk is when they remove nicotine from Poison Act lah. So those already happened. We can't do anything about that. If you want to say, we want to reverse everything, there's a very big complication with regard to legal. Careful with that. They mean the tobacco industry. They are even better in terms of legal. You want to change that back, sometimes it will create macam embargo period where all the law stops. So careful. So we have to use whatever means that we have and never stop. Don't give up. So we can do with cigarette smoking. Try to do now for e-cigarette. So if you ask me, every talk I have, I will say that pay attention to e-cigarette. Pay attention to e-cigarette. Now they change now. No longer typical sedut. Ada yang just hidup, tak bakar pun, sniff. Ada yang pakai puncang dalam teh nikotin. So they are more creative now. So we have to be even more creative. 1 hour I thought.
The wall was dedicated to me.
They can. Don't let me go in.
We just have to think of different ways how to overcome this. Because people today just keep on trying to change and improvise their device.
The other one, I think remember about monitor. So I believe lab studies on the danger of liquid and e-cigarette and all the other different heat not burn product, all those kind of things must be done. It is very expensive research though because it requires lab. But I urge, try your best to pitch for research grant and try to do this research. This will add into our meta-analysis and eventually we get a lot of data, and this is where the M component, monitoring component, becomes important. And for Malaysia, our worry, even the police also worry, even though among them ramai smoker, about vape ni adalah now they put in dadah dalam container. So now environmentalist pula kalau datang, dia kata you have to do open container, boleh refill. Kita pula kata no, must be closed system. So what I try to say here is that we need data. So I also urge everybody, especially we are here in a university environment, if you have opportunity to apply and pitch for grant, pitch for this safety profile of e-cigarette. We must have a strong data to say that e-cigarette is not safe. But we must have our own local data. And that's why I personally do not never agree vape as harm reduction. Personally, if you go for certain, some says that they want to use that. If you want to use that, be very careful because it is not like condom. Because condom safety profile safe lah. Vape, mana ada safety profile? Dia tak boleh lah. So tak ada safety profile, so cannot simply use those. So please, these are the things that I hope that more and more research to be conducted.
Any questions or points for discussion? It's been a very interesting issues that we are facing right now, right? After all the years that we managed to control tobacco, suddenly this new thing came about. So e-cigarette and vape is a real challenge. Kalau tak ada soalan, any last words from Dr. Kaya?
Okay, right. It has been very interesting talking to Prof. But for those of you who are seeing patients, okay, we know the 5 A's. We know the most important thing is to ask. But if you do a survey on our doctors, most of them do not ask. Yeah? And furthermore, now there is vape, yang tu lagi lupa langsung. So always remember to ask. If you ask them 10 times, then sometimes it goes into their head, okay, I must do something about this. So always remember, because you saw the figures, that is one patient, 1 year, times 40, one center alone, dah bankrupt dah. Yeah, I mean, and now MOF suruh cut off our budget, so what about the other things? So we must do something, and inshallah there is always a way to do it.
For me, my message is that we have seen the success of policies for cigarette smoking, tobacco smoking. So we can also do the same with e-cigarette. But I wonder, sebenarnya I'm worried, because when we now try to denormalize vaping, I worry that those who are purely vaping now change to cigarette. So again, I told Hanifi, because we are at the same university, we have to do a study about this, a little baseline study first, and because this is part of the M, monitor, so behavior. So we want to detect the prevalence of, because gateway now, instead of, I mentioned that there are many who are dual users, but then we also have purely vapers. So when we denormalize vape, because they are already addicted to nicotine, they switch back to cigarette. Because cigarette is let's say now become somehow less, there's no sentiment, less entirely. So these are the very unique kind of thing, and number one. Number two, there are things we can do, there are things we cannot do. Just look at things that we can do within our capacity at where we are, within the resources that we have. we don't have to say that because I don't have 1 million grant, I can't do this. Because I have a small grant, I can only do this. Doesn't matter. Small is better than don't do at all. So try our best, inshallah. Whatever means that we have, and don't forget that if you have a good content or smoking vape, but don't behave like somebody that use vulgar word. I still believe that regardless how we don't like vaping, we don't hate the vapers. It is their behavior that we don't like, but not they themselves. So compassion must always be there, and I still believe in a proper, not emotional, provocating kind of content. Just give information. Inshallah. Try our best. Thank you.
Thank you very much, Dr. Nohayati. With that, we end our session here.